Welcome, dear viewers, to this important discussion about prostate health and conscious masturbation. Today, we're going to explore a topic that's crucial for men's well-being, especially as we age. If you're a man over 60 or know someone who is, this video is for you. We'll be talking about something that's often considered taboo, but is actually a normal and healthy part of life. Let's start by addressing the elephant in the room. Yes, we're going to talk about the prostate and masturbation. Now, I know some of you might feel a bit uncomfortable, but remember, there's nothing to be ashamed of. These are natural aspects of the male body and its functions. By the end of this video, you'll have a better understanding of how to take care of your prostate health and why masturbation can be a positive part of that care. First, let's talk about the prostate itself. This small gland, about the size of a walnut, plays a big role in men's health. Located just below the bladder and in front of the rectum, the prostate is part of the male reproductive system. Its main job is to produce fluid that nourishes and protects sperm. This fluid makes up a significant part of semen and helps sperm travel and survive. As men age, the prostate often undergoes changes. It's completely normal for the prostate to grow, larger as you get older. However, these changes can sometimes lead to health issues. That's why it's so important to understand what's happening with your body and how to take care of it. Now, let's dive into some of the common prostate problems that men, especially those over 60, might face. The first one we'll discuss is benign prostatic hyperplasia, or BPH. Don't let the long name scare you. It simply means a non-cancerous enlargement of the prostate. BPH is incredibly common. In fact, about half of all men between the ages of 51 and 60 have it. By age 80, up to 90% of men may experience some symptoms of BPH. What does BPH feel like? Well, since the prostate surrounds part of the urethra, the tube that carries urine out of the body, when it enlarges, it can squeeze this tube. This can lead to various urinary symptoms. You might find yourself needing to urinate more frequently, especially at night. Or you might have trouble starting to urinate, experience a weak stream, or feel like you can't empty your bladder completely. These symptoms can be frustrating and affect your quality of life, but remember, they're manageable with proper care and treatment. Another common prostate issue is prostatitis, which is inflammation of the prostate gland. Unlike BPH, prostatitis can affect men of all ages, though it's more common in men under 50. There are several types of prostatitis, ranging from acute bacterial prostatitis, caused by a bacterial infection and treatable with antibiotics, to chronic prostatitis, which can last for months and may not have a clear cause. Symptoms of prostatitis can include pain or discomfort in the pelvic area, difficulty urinating, pain during ejaculation, and sometimes fever or chills. If you experience these symptoms, it's important to see a doctor, as prostatitis can significantly impact your quality of life if left untreated. Lastly, we need to talk about prostate cancer. It's a serious topic, but knowledge is power, and understanding the risks can help you stay proactive about your health. Prostate cancer is one of the most common cancers in men, especially as the good news is that when caught early, prostate cancer is often treatable. The risk of prostate cancer increases with age, and it's rare in men younger than 40. However, your risk is higher if you have a family history of prostate cancer or if you're African American. The symptoms of prostate cancer can be similar to those of BPH, including difficulty urinating, frequent urination, and sometimes blood in the urine or semen. However, early prostate cancer often has no symptoms at all, which is why regular checkups and screenings are so important. Now that we've covered the basics of prostate health and common issues, let's talk about something that might surprise you: the potential benefits of masturbation for prostate health. Yes, you heard that right. Regular ejaculation, whether through sexual activity with a partner or masturbation, may actually be good for your prostate. several studies have suggested that men who ejaculate more frequently may have a lower risk of prostate cancer. One large study found that men who ejaculated 21 or more times a month had a 33% lower risk of prostate cancer compared to men who ejaculated 4 to 7 times a month. While more research is needed to fully understand these findings are certainly intriguing. But how might ejaculation help protect against prostate cancer? There are a few theories. One is that ejaculation helps flush out carcinogens, cancer-causing substances, from the prostate gland. Another theory suggests that frequent ejaculation reduces the buildup of crystalloids in the prostatic fluid, which have been associated with prostate cancer. It's important to note that masturbation isn't just about potential health benefits. It's a normal, healthy part of human sexuality that can provide pleasure, stress relief, and even better sleep. For many men, especially as they age or if they don't have a sexual partner, masturbation can be an important part of maintaining sexual function and overall well-being. However, it's crucial to approach masturbation mindfully and as part of a holistic approach to health. In the next section, we'll discuss techniques for conscious masturbation and how to incorporate this practice into a healthy lifestyle. Remember, the goal is to take care of your body in a way that feels comfortable and right for you. As we move forward in our discussion, we'll explore more about how diet, exercise, and regular checkups play a role in maintaining prostate health. We'll also delve deeper into the psychological aspects of sexual health and how to overcome any embarrassment or discomfort you might feel about discussing these topics with your healthcare provider. Remember, taking care of your prostate health is an important part of aging well. By staying informed and proactive, you can significantly improve your quality of life and overall health. In our next segment, we'll discuss specific techniques for conscious masturbation and how to make it a positive part of your self-care routine. Stay tuned, because this information could make a real difference in your life or the life of someone you care about. Now that we've laid the groundwork for understanding prostate health and its connection to sexual activity, let's delve into the concept of conscious masturbation. This approach transforms masturbation from a purely physical act into a mindful practice that can benefit both your physical and mental well-being. Conscious masturbation involves being fully present and aware during the act, rather than rushing through it or using it solely as a means to relieve tension. It's about connecting with your body, understanding its responses, and cultivating a positive relationship with your sexuality. This practice can be particularly beneficial for older men who may be experiencing changes in their sexual function or grappling with societal taboos around sexuality in later life. To begin practicing conscious masturbation, start by creating a comfortable and private environment. This might mean setting aside specific time when you won't be interrupted, dimming the lights, or playing relaxing music. The goal is to create a space where you feel completely at ease and free from distractions. Next, focus on your breathing. Take slow, deep breaths to help relax your body and mind. This simple act can help reduce any anxiety or stress you might be feeling and allow you to be more present in the moment. As you breathe, pay attention to the sensations in your body. Notice areas of tension and try to consciously relax those muscles. As you begin to touch yourself, do so with intention and awareness. Instead of focusing solely on genital stimulation, explore different parts of your body. Pay attention to what feels good and what doesn't. This exploration can help you become more attuned to your body's responses and can even lead to discovering new sources of pleasure. Remember, the goal isn't necessarily to reach orgasm as quickly as possible. Instead, focus on the journey and the sensations you're experiencing along the way. If you find your mind wandering or getting caught up in performance anxiety, gently bring your attention back to your breath and the physical sensations in your body. Incorporating Kegel exercises into your masturbation routine can also be beneficial for prostate health. Kegel exercises involve contracting and relaxing the pelvic floor muscles, which support the bladder, bowel, and sexual function. To do a Kegel exercise, imagine you're trying to stop the flow of urine midstream. The muscles you use to do this are your pelvic floor muscles. Contract these muscles for a few seconds, then relax. You can do this during masturbation or separately as part of your daily routine. Regular practice of Kegel exercises can help improve bladder control, reduce symptoms of benign prostatic hyperplasia, and even enhance sexual performance. For men dealing with erectile dysfunction, Kegel exercises can be particularly helpful in improving erectile function. It's important to note that while conscious masturbation and regular ejaculation can be beneficial for prostate health, they should be part of a broader approach to wellness. This includes maintaining a healthy diet, engaging in regular physical activity, and staying on top of your medical checkups. Speaking of diet, let's explore how what you eat can impact your prostate health. Nutrition plays a crucial role in overall health, and the prostate is no exception. Certain foods have been linked to better prostate health, while others may increase the risk of prostate problems. One of the most important dietary factors for prostate health is antioxidants. These compounds help protect your cells from damage caused by free radicals, which can contribute to cancer and other diseases. Foods rich in antioxidants include berries, leafy green vegetables, and nuts. Tomatoes deserve a special mention when it comes to prostate health. They're rich in a compound called lycopene, which has been linked to a reduced risk of prostate cancer. Cooked tomatoes, such as those in tomato sauce or soup, are especially beneficial as cooking increases the bioavailability of lycopene. Fatty fish like salmon, mackerel, and sardines are excellent for prostate health due to their high content of omega-3 fatty acids. These healthy fats have anti-inflammatory properties and may help reduce the risk of prostate cancer. If you're not a fan of fish, you can consider taking a high-quality fish oil supplement, but always consult with your doctor before starting any new supplement regimen. Cruciferous vegetables like broccoli, cauliflower, and Brussels sprouts contain compounds that may help protect against prostate cancer. These vegetables are also rich in fiber, which is important for overall digestive health and can help maintain a healthy weight, another factor in prostate health. Green tea is another beneficial addition to your diet. It contains polyphenols, particularly a catechin called EGCG, which has been shown to have anti-cancer properties. Drinking several cups of green tea a day may help reduce the risk of prostate cancer and support overall prostate health. On the flip side, there are certain foods you might want to limit for the sake of your prostate. Red meat and processed meats have been linked to an increased risk of prostate cancer when consumed in large quantities. While you don't need to eliminate these foods entirely, it's wise to consume them in moderation. Dairy products, especially those high in saturated fat, have also been associated with an increased risk of prostate cancer in some studies. If you enjoy dairy, consider opting for low-fat options or plant-based alternatives. Lastly, it's crucial to limit your intake of sugar and refined carbohydrates. These foods can contribute to inflammation in the body, which may increase the risk of various health problems, including prostate issues. Instead, opt for complex carbohydrates like whole grains, which provide fiber and other important nutrients. Remember, hydration is also key to prostate health. Drinking plenty of water helps flush toxins from your body and can help prevent urinary tract infections. Aim for at least 8 glasses of water a day, more if you're physically active or live in a hot climate. While we're on the topic of lifestyle factors, let's discuss the importance of regular physical activity for prostate health. Exercise isn't just good for your heart and waistline, it can also benefit your prostate. Regular physical activity has been linked to a reduced risk of benign prostatic hyperplasia, BPH, and may also help lower the risk of prostate cancer. You don't need to become a marathon runner to reap the benefits. Moderate exercise, such as brisk walking for 30 minutes a day, can make a significant difference. Other good options include swimming, cycling, or even gardening. The key is to find activities you enjoy and can stick with long-term. For men dealing with prostate issues, certain exercises can be particularly beneficial. Aerobic exercises can help reduce inflammation throughout the body, including in the prostate. Strength training, especially exercises that target the lower body and core, can help strengthen the pelvic floor muscles, which support the prostate and can improve urinary function. However, it's important to listen to your body and not overdo it. High-impact activities or exercises that put excessive pressure on the pelvic area might exacerbate prostate symptoms in some men. If you're unsure about what types of exercise are safe for you, consult with your doctor or a physical therapist who specializes in men's health. In addition to its physical benefits, regular exercise can also help manage stress and improve mood, factors that can indirectly impact prostate health. Chronic stress has been linked to inflammation in the body, which can contribute to various health issues, including prostate problems. Exercise is one of the most effective ways to reduce stress and promote overall well-being. As we wrap up this section, remember that caring for your prostate is about more than just addressing problems when they arise. It's about taking a proactive approach to your health, which includes regular checkups and screenings. In the next part of our discussion, we'll delve into the importance of routine exams and how to overcome any hesitation you might feel about discussing prostate health with your healthcare provider. Now that we've covered the importance of diet and exercise for prostate health, let's talk about one of the most crucial aspects of maintaining your well-being: regular checkups and preventive screenings. For many men, especially those over 60, the idea of discussing prostate health with a doctor can be uncomfortable or even embarrassing. However, these checkups are vital for early detection and treatment of potential problems. The American Cancer Society recommends that men should have a discussion with their healthcare provider about prostate cancer screening at age 50 for those at average risk. However, for men at higher risk, such as African American men or those with a family history of prostate cancer, this conversation should start earlier, around age 45. There are two main types of prostate cancer screening tests: the prostate-specific antigen, PSA, blood test, and the digital rectal exam, DRE. Let's discuss each of these in detail to help demystify the process and ease any concerns you might have. The PSA test measures the level of prostate-specific antigen in your blood. PSA is a protein produced by both cancerous and non-cancerous tissue in the prostate. While it's normal to have some PSA in your blood, higher levels may indicate prostate cancer, inflammation, enlargement, or infection. It's important to note that an elevated PSA level doesn't necessarily mean you have cancer. It simply means further testing may be needed. The digital rectal exam, or DRE, involves a doctor inserting a gloved, lubricated finger into the rectum to feel the prostate gland. This allows the doctor to check for any abnormalities in the size, shape, or texture of the prostate. While this exam can feel awkward or uncomfortable, it's typically quick and shouldn't be painful. Many men avoid these screenings due to embarrassment or fear. It's crucial to overcome these feelings for the sake of your health. Remember, doctors are professionals who perform these exams routinely. They're not there to judge you. Their sole focus is on your health and well-being. If you're feeling anxious about a prostate exam, here are some tips that might help. First, communicate your concerns with your doctor. They can explain the process in detail and answer any questions you might have. This can help alleviate anxiety and make you feel more in control. Second, try relaxation techniques before and during the exam. Deep breathing exercises can help calm your nerves. Remember, the more relaxed you are, the more comfortable the exam will be. Third, consider bringing a trusted friend or family member with you for support. They can wait in the waiting room or even be present during the consultation if you're comfortable with that. Lastly, remind yourself of the importance of these screenings. Early detection can make a significant difference in the treatment and prognosis of prostate issues, including cancer. In addition to these specific prostate exams, your regular checkups should include discussions about any changes you've noticed in your urinary or sexual function. Don't be shy about bringing up these topics with your doctor. They need to know about any symptoms you're experiencing to provide the best care possible. Now, let's shift our focus to the psychological aspects of prostate health and sexual well-being. As men age, changes in sexual function are common and can have a significant impact on mental health and relationships. It's important to address these changes openly and seek support when needed. Erectile dysfunction, ED, is a common concern for many older men. While it can be related to prostate issues, it can also be caused by other factors such as cardiovascular problems, diabetes, or certain medications. If you're experiencing ED, it's crucial to discuss this with your doctor. Not only can they help identify the cause and suggest treatments, but ED can sometimes be an early warning sign of other health issues. Remember, experiencing changes in sexual function doesn't mean your sex life is over. There are many ways to maintain intimacy and sexual satisfaction, even if traditional intercourse becomes challenging. This might involve exploring different forms of physical intimacy, using sexual aids, or trying new techniques. The key is to keep an open mind and maintain open communication with your partner. For some men, changes in sexual function can lead to feelings of inadequacy or depression. It's important to recognize these feelings and seek help if needed. Talking to a therapist or counselor who specializes in sexual health can be incredibly beneficial. They can help you navigate the emotional aspects of these changes and develop coping strategies. It's also crucial to maintain open communication with your partner about these issues. Many men find it difficult to discuss sexual problems, but keeping silent can lead to misunderstandings and strain in the relationship. Your partner may be experiencing their own concerns or changes. An open dialogue can help you support each other and find solutions together. Another psychological aspect to consider is the impact of stress on prostate health. Chronic stress can contribute to inflammation in the body, which may exacerbate prostate issues. Additionally, stress can affect sexual function and overall well-being. Learning effective stress management techniques can be beneficial for both your mental and physical health. Some effective stress reduction techniques include mindfulness meditation, deep breathing exercises, and progressive muscle relaxation. Regular exercise, as we discussed earlier, is also an excellent stress buster. Finding hobbies or activities that you enjoy and that help you relax is crucial for maintaining good mental health. It's also worth mentioning the importance of social connections as we age. Maintaining friendships and staying socially active can have significant benefits for mental health and overall well-being. Don't hesitate to reach out to friends, join social groups, or participate in community activities. These connections can provide emotional support and help combat feelings of isolation that sometimes come with aging. As we near the end of this section, let's touch on the topic of modern treatments for prostate problems. Medical science has made significant advancements in recent years, offering a range of options for managing prostate issues. For benign prostatic hyperplasia, BPH, treatments can range from lifestyle changes and medications to minimally invasive procedures. Alpha blockers and 5-alpha reductase inhibitors are commonly prescribed medications that can help relieve symptoms of BPH. For more severe cases, there are several minimally invasive procedures available that can help reduce the size of the prostate and improve urinary function. In the case of prostate cancer, treatment options depend on various factors, including the stage of the cancer, your overall health, and your personal preferences. These can include active surveillance for slow-growing cancers, radiation therapy, surgery, hormone therapy, and newer treatments like immunotherapy. It's important to have thorough discussions with your healthcare provider about all available options, their potential benefits, and side effects. Remember, every case is unique, and what works best for one person may not be the ideal solution for another. As we conclude this section, let's emphasize again the importance of a holistic approach to prostate health. This includes maintaining a healthy diet, staying physically active, managing stress, keeping up with regular checkups, and being open about any changes or concerns you experience. By taking a proactive approach to your health, you can significantly improve your quality of life and overall well-being. Now that we've covered the medical aspects of prostate health, let's delve deeper into how you can integrate all this information into a healthy lifestyle. Remember, taking care of your prostate isn't just about medical checkups and treatments. It's about creating a holistic approach to your overall well-being. Let's start by discussing how to create a prostate-friendly daily routine. This routine should incorporate elements of diet, exercise, stress management, and self-care. By making small, consistent changes to your daily habits, you can significantly impact your prostate health and overall quality of life. Begin your entire day with a glass of water. Staying hydrated is crucial for prostate health, as it helps flush toxins from your body and supports proper urinary function. Throughout the day, aim to drink at least 8 glasses of water. If you find plain water boring, try infusing it with slices of lemon, cucumber, or berries for added flavor and nutrients. For breakfast, consider options that are rich in prostate-friendly nutrients. A bowl of oatmeal topped with ground flax seeds and berries is an excellent choice. Oatmeal provides fiber, which is important for digestive health, while flax seeds are rich in omega-3 fatty acids and lignans, which may help reduce the risk of prostate cancer. Berries, as we discussed earlier, are packed with antioxidants that support overall health. Incorporate physical activity into your morning routine. This could be as simple as a brisk 30-minute walk around your neighborhood. Remember, consistency is key when it comes to exercise. It's better to do moderate activity regularly than to push yourself too hard occasionally. If walking isn't your thing, consider swimming, cycling, or even gardening. The important thing is to find activities you enjoy and can stick with long-term. For lunch, focus on incorporating a variety of colorful vegetables into your meal. A large salad with leafy greens, tomatoes, and cruciferous vegetables like broccoli or cauliflower is an excellent choice. Add some grilled chicken or fish for protein and dress it with olive oil and lemon juice for a dose of healthy fats. In the afternoon, consider practicing some stress reduction techniques. This could be a short meditation session, some deep breathing exercises, or even a power nap if that works for you. Managing stress is crucial for overall health, including prostate health, as chronic stress can contribute to inflammation in the body. For dinner, try to include fatty fish like salmon at least twice a week. These fish are rich in omega-3 fatty acids, which have anti-inflammatory properties. Pair it with a side of steamed vegetables and some whole grains for a balanced meal. Remember to limit your intake of red meat and processed foods, as these have been linked to an increased risk of prostate issues. Before bed, engage in some relaxing activities to prepare your body for rest. This could include reading a book, listening to calming music, or practicing gentle stretching or yoga. Good sleep is essential for overall health and can help manage stress levels. Now, let's talk about how to maintain this healthy lifestyle in the long term. One of the biggest challenges people face when trying to make lifestyle changes is consistency. It's easy to start strong, but then gradually slip back into old habits. Here are some strategies to help you stay on track. First, set realistic goals. Don't try to overhaul your entire lifestyle overnight. Instead, focus on making small, sustainable changes. For example, you might start by adding 1 extra serving of vegetables to your daily diet, or by taking a 15-minute walk each day. As these small changes become habits, you can gradually add more. Second, track your progress. Keep a journal of your diet, exercise, and how you're feeling. This can help you stay motivated as you see improvements in your health and energy levels over time. It can also help you identify any patterns or triggers that might be affecting your prostate health. Third, find an accountability partner. This could be a spouse, a friend, or even a support group for men's health. Having someone to share your goals with and report your progress to can provide motivation and support when you're facing challenges. Fourth, be prepared for setbacks. It's normal to have days where you don't stick to your healthy habits perfectly. The key is not to let these occasional slip-ups derail your entire efforts. If you have an unhealthy meal or miss a few days of exercise, simply get back on track with your next opportunity. Remember, it's the overall pattern of your lifestyle that matters, not individual instances. Fifth, regularly reassess and adjust your routine. As you age, your body's needs may change. What worked for you at 60 might need to be adjusted at 70 or 80. Stay in tune with your body and don't hesitate to consult with your healthcare provider about adjusting your health routine as needed. Lastly, don't forget the importance of social connections in maintaining a healthy lifestyle. Engage in activities that allow you to socialize with others. This could be joining a walking group, participating in community events, or even taking classes to learn new skills. Social connections not only provide emotional support, but can also help keep you accountable to your health goals. Now, let's address a topic that many men find difficult to discuss: the impact of prostate health on intimate relationships. Changes in prostate health, whether due to natural aging processes or medical conditions, can affect sexual function and intimacy. It's crucial to approach these changes with openness, understanding, and a willingness to adapt. If you're in a relationship, maintain open communication with your partner about any changes you're experiencing. This includes changes in sexual function, urinary habits, or general discomfort. Remember, your partner is likely to be supportive and understanding, but they can only help if they know what's going on. For those experiencing erectile dysfunction or other sexual changes, it's important to remember that intimacy is about more than just sexual intercourse. Explore other ways to maintain physical and emotional closeness with your partner. This could include activities like massage, cuddling, or simply spending quality time together. If sexual changes are causing distress, don't hesitate to seek help from a healthcare provider or a therapist specializing in sexual health. There are many treatment options available, from medications to therapy, that can help address these issues. For single men, changes in prostate health or sexual function can impact self-esteem and the desire to pursue new relationships. It's important to remember that these changes don't define your worth as a person or a potential partner. Focus on self-care, maintaining overall health, and cultivating self-confidence. If you're considering entering a new relationship, be honest about your health situation when you feel the time is right. A supportive partner will understand and be willing to work with you. As we near the end of this section, let's talk about the importance of staying informed about prostate health. Medical research is constantly evolving, and new treatments and preventive strategies are being developed. Make it a habit to stay updated on the latest health information from reliable sources. This could include reputable health websites, medical journals, or discussions with your healthcare provider. Consider joining a support group for men's health or prostate issues. These groups can provide valuable information, emotional support, and a sense of community. They can be particularly helpful if you're dealing with a prostate condition or recovering from treatment. Remember, taking care of your prostate health is an ongoing process. It's not about perfection, but about making consistent efforts to support your overall well-being. By incorporating the strategies we've discussed into your daily life, you're taking important steps towards maintaining your health and quality of life as you age. As we approach the conclusion of our comprehensive discussion on prostate health and conscious self-care, let's take a moment to recap the key points we've covered and look at how you can move forward with this information. Throughout this video, we've explored various aspects of prostate health, from understanding the basic functions of the prostate gland to discussing specific strategies for maintaining its health. We've talked about common prostate issues like benign prostatic hyperplasia, BPH, prostatitis, and prostate cancer, and we've delved into the importance of regular checkups and screenings. We've also discussed the potential benefits of conscious masturbation for prostate health, breaking down taboos and emphasizing the importance of a healthy relationship with your own body. Remember, taking care of your sexual health is a crucial part of overall well-being, especially as you age. One of the most important takeaways from our discussion is the significance of a holistic approach to prostate health. This means considering all aspects of your lifestyle, including diet, exercise, stress management, and mental health. Let's revisit some of these key areas. In terms of diet, we've emphasized the importance of a balanced, nutrient-rich eating plan. Foods that are particularly beneficial for prostate health include tomatoes, fatty fish rich in omega-3s, cruciferous vegetables like broccoli and cauliflower, and foods high in antioxidants such as berries and green tea. Remember to limit your intake of red meat, processed foods, and excessive dairy, as these have been linked to increased risk of prostate issues. Regular physical activity is another crucial component of prostate health. We've discussed how moderate exercise, such as brisk walking, swimming, or cycling, can help reduce inflammation, manage weight, and improve overall health. The key is to find activities you enjoy and can maintain consistently. Stress management is an often overlooked but vital aspect of prostate health. Chronic stress can contribute to inflammation in the body and may exacerbate prostate issues. We've explored various stress reduction techniques, including mindfulness meditation, deep breathing exercises, and the importance of maintaining social connections. We've also addressed the psychological aspects of prostate health, including the impact on self-esteem and relationships. Remember, it's normal to experience changes in sexual function as you age, but these changes don't define your worth or your capacity for intimacy. Open communication with partners and seeking professional help when needed are important strategies for navigating these changes. Now, as we wrap up this discussion, let's look at some actionable steps you can take to implement what you've learned. First, if you haven't already, schedule a checkup with your healthcare provider. Discuss your prostate health, including any symptoms you may be experiencing, and ask about appropriate screenings based on your age and risk factors. Don't let embarrassment prevent you from having these crucial conversations. Remember, your doctor is there to help you maintain your health. Second, start making gradual changes to your diet. Try incorporating more prostate-friendly foods into your meals. This doesn't mean you need to completely overhaul your eating habits overnight. Start small. Perhaps add an extra serving of vegetables to your dinner, or swap out red meat for fish once or twice a week. Over time, these small changes can add up to significant improvements in your health. Third, establish a regular exercise routine. If you're not currently active, start with short walks and gradually increase your activity level. Remember, consistency is more important than intensity. Aim for at least 30 minutes of moderate activity, most days of the week. Fourth, implement stress reduction techniques into your daily routine. This could be as simple as taking a few minutes each day for deep breathing exercises, or setting aside time for activities you find relaxing, such as reading, gardening, or spending time in nature. Fifth, if you're experiencing any changes in urinary or sexual function, don't ignore them. While some changes are a normal part of aging, others may indicate underlying health issues. Keep track of any symptoms and discuss them with your healthcare provider. Sixth, consider joining a support group or online community focused on men's health or prostate issues. These groups can provide valuable information, emotional support, and a sense of community. Sharing experiences and learning from others who are going through similar situations can be incredibly beneficial. Seventh, stay informed about prostate health. Medical knowledge is constantly evolving, and new treatments and preventive strategies are being developed. Make it a habit to seek out reliable health information from reputable sources. Your healthcare provider can be an excellent resource for up-to-date, personalized health information. Eighth, if you have a partner, involve them in your prostate health journey. Open communication about your health can strengthen your relationship and ensure you have support in maintaining your well-being. If you're single, consider confiding in a close friend or family member who can provide support and encouragement. Ninth, remember the potential benefits of conscious masturbation that we discussed. If you're comfortable with this practice, consider incorporating it into your self-care routine. remember to approach it mindfully, focusing on overall well-being, rather than just physical release. Lastly, be patient and kind to yourself. Improving your health is a journey, not a destination. There may be setbacks along the way, but what's important is your overall commitment to taking care of yourself. Celebrate small victories and don't be discouraged by temporary setbacks. As we conclude this video, I want to emphasize that taking care of your prostate health is an act of self-love and responsibility. By prioritizing your health, you're not only improving your own quality of life, but also positively impacting those around you. A healthier you means you can be more present and engaged in your relationships, your community, and your passions. Remember, it's never too late to start taking better care of yourself. Whether you're in your 60s, 70s, 80s, or beyond, there are always steps you can take to improve your health and well-being. The key is to start where you are, use what you have, and do what you can. I hope this video has provided you with valuable information and practical strategies for maintaining your prostate health. Remember, you're not alone on this journey. There are healthcare professionals, support groups, and resources available to help you every step of the way. Thank you for taking the time to invest in your health by watching this video. If you found this information helpful, please consider sharing it with others who might benefit. Don't forget to subscribe to our channel for more health and wellness content tailored for men in their golden years. Before we sign off, I'd like to leave you with one final thought. Your health is your most valuable asset. Treat it with the care and attention it deserves. Here's to your health, your happiness, and your continued vitality in the years to come. Take care, stay healthy, and remember, it's never too late to start prioritizing your well-being. Until next time.